Hello everyone, Dr. Greg Murphy. I haven't done a COVID-19 update in a while. I just wanted to continue the conversation. Now we've been in this pandemic for about 9 months, and it's taken its toll on us. People are stressed out. But despite now what we're seeing, despite masks, despite social spacing and all these things, we continue to see a rise in the number of infections and unfortunately a rise in fatalities. But there's also a toll on another part that doesn't have to do necessarily with physical health, but mental health. We've seen businesses fail, restaurants fail. We've seen domestic violence go up, mental health challenges go up. Our kids' education is not really where it should be. Video learning has taken over for a lot of kids, and they just don't respond that way. So this has been a balancing act for our nation. I think overall, when we look at some of the statistics, I think the United States has actually fared fairly well during this pandemic. And so let's take a look through some of this stuff. I apologize if some of the graphics are not perfect on this, but I'm going to try to talk your way through this. We're seeing world cases. Western Europe has really taken its biggest toll. United States, obviously, Brazil, some of the South American countries. China, guys, I'm sorry, I just don't believe much that comes out of China. So it's important to try to look at things entirely. We don't know much that's coming out of Central Africa either. Daily COVID case rate here in the United States. What we saw in this graph will continue to be seen in other places. Number of cases went up in April, they went up again in the summertime, and now we're seeing them come up again. State comparison of new cases. And again, this is a little bit hard to read. I'm going to walk you through this. This is New York. And what New York saw at the beginning of the year, back here in April, was a big rise in the number of cases. Everybody else stayed a little bit slower here. Texas took a big hit towards the summertime. I'm pointing out Tennessee, North Carolina, South Carolina, Virginia, where we all were fairly close in the number of cases, and that's really remained this way. And unfortunately, there have been surges in different parts of the country. The international new case comparison, I think, is important. Again, pointing out the United States, we're right here on this line where we're seeing the surge in the summertime, another surge again. But let's look at other countries, and I think it's important to look at other countries like us. United Kingdom, they were down. They had the big bump at the beginning of the year. They did a much bigger lockdown than we did, locked down the number of cases. But what are they seeing now? They're seeing a much greater rise in the number of cases comparatively than we are. Same thing with Spain, same thing with Switzerland. Belgium right now is really having a very, very hard time. These countries locked down a lot, but what we didn't think that we had hoped we'd open the door back again and the virus would be gone. Unfortunately, we're not. Hospitalization rates. Again, this is a very similar curve what we saw before. Hospitalizations went up in April and May. They did the same thing in the summertime, and we're seeing the rates of hospitalization go up. That's the number of people in the hospital. But I think it's important also that we look at the death in the United States. That's a hard thing to face. We saw a really big surge here in the early part of the year in April and May. Again, we had a bump in the summertime. We've been relatively stable in the number of people who've perished from this disease every day now here for the last couple of months. That's important to know because the U.S. case fatality rate, the number of individuals, the percentage of individuals who get positive tests who actually pass away once hospitalized has gone down in the United States. And we fare very comparatively for the rest of the world. If we look here in April and May, we were up about 6%. And what we've seen is a gradual and persistent decline in our case fatality rate. But let's look at the international case fatality rate. Again, here's the United States down here. At the peak, we were about 6 or 7%. Now we're down around 3%. This is 5%, 10% line, 15% line. Poor France, they went up to about 18% fatality rate. Italy, the same thing, had another curve, and they've come down. Belgium, the same kind of thing, and they've come down. But still, here in the United States, we kept it relatively low and have continued to do so compared to some of these other countries. COVID testing in the United States. At the beginning of this pandemic, everybody was in a great clamor. We need more testing, we need more testing, we need more testing. Well, this has been a fantastic testament to the administration, to public-private partnerships, to put forth American know-how to basically explode the number of tests. Look at what we've gone to from March, and we are blowing through the roof today. And what does that mean? That means here in the United States in the last week, we were averaging over 1 million tests a day in the United States. 1.1 million, 1.2, 1.2, 1.1, 1.1 million. Those are the number of people that are being tested in a country with 330 million people every day. That is nothing short of astounding from where we started. The positive test rate You can't see this line very well, and I apologize. These are the number of tests that we've talked about just a second ago going up. The positive test rate, the people who are testing positive when we take those tests. Well, anybody knows the more you look for something in medicine, the more you're going to find it. And that has, in part, let me just say in part, contributed to the increased number of positive tests. Not completely, but in part. But what we've seen again is that curve up in May, up in the summertime, and now increasing again. In part due to the number of tests that are being done, because there have been so many people that have been asymptomatic, but we are having, again, we saw hospitalizations going up, more symptomatic people also. State positivity rates. So in the Northeast here, these states, the Northeast, Connecticut, New Hampshire, they had the big surge at first. Now their state positive rates are less than 5%. What we're seeing now in some of the states that really were didn't have this virus earlier in the year, Wyoming, Idaho, South Dakota, they're having a much higher increase in the number of cases they have and positive test rate. Just to show you, all statistics are not perfect. This one line here says in Puerto Rico, every single person who got tested is positive. So you have to take all statistics literally with a grain of salt. North Carolina is around here. We're not quite at that 5% rate, but there are a lot of states here in the middle. Actually, 36 states are not really where we need to be as far as the number of tests. Excess deaths. You know, guys, unfortunately, a part of life is passing away. We lose people to heart attacks, cancer, those type of things every year. This year, we've lost probably 300,000 more individuals because of COVID-19, because of this year. But 2 out of 3 of these excess deaths were directly related to COVID-19. What's important here also, the largest percentage increases were in our Hispanic population and adults 25 to 45. We say, why is that? Think about that statistic. We normally don't lose a lot of folks ages 25 to 44 every year, but any increase in that is a larger percentage increase in that. So again, it's statistics, and we have to take those with a grain of salt. Just so you know, world population, we still have 7.8 billion people. We have a net population increase every day of 150,000 people every day here in the United States. Again, I've said this and I'm going to say it again. We have 2 ways out of this. Either people get infected, they become immune, but we don't know how long that immunity lasts, or we take a vaccine. I think it's very important. We're going to have folks that don't want to take a vaccine. I understand that. Can't say I agree with it, but I understand that. There is not going to be any mandatory vaccine here in the United States. But I want to just talk about, there is an independent review that's going to be going on of these vaccines. Dr. Stephen Hahn at the FDA and Dr. Marks, who's the director for the Center for Biologics Evaluation Research. We are committed to expediting the development of a COVID-19 vaccine, but not at the expense of sound science and decision-making. We will not jeopardize the public's trust in our science-based, independent review of these or any vaccines. There is too much at stake. So guys, when these vaccines finally come through their phase 3 trials, they will have independent reviews to make sure that they are safe and effective for you and I. In the meanwhile, you know, I said earlier in the year, and some people gave me a hard time about that, about sunshine. How do we get sunshine? How do we get vitamin D? We get it via sunshine. So study finds, this was yesterday, and this has been in several different journals, study finds that over 80% of COVID-19 patients, these are people in the hospital, have vitamin D deficiency. So guys, vitamin D is an important part of modulating our immune response. I take a vitamin D tablet every day. So until we get a vaccine, I would recommend people taking a supplement. You don't have to take 5,000% of this, but a supplement with vitamin D every day. Guys, this has been a tough year. Just remember, we have elections next week. At the end of the day, we are all Americans, not Democrats, Republicans. We are all Americans. So please, let's try to gather around this, come together, and I think we'll have a bright future if we do that. Thank you so much. God bless and stay safe.